Anatomy of lungs with its vascular, lymphatic, and nerve supply. I'm Dr. Vignesh K, Senior Resident, Department of Respiratory Medicine, Sri Lakshminarayan Institute of Medical Science. Today we are going to see about anatomy of lungs, its vascular supply, lymphatic supply, and nerve supply. Anatomy. We are going to see about lungs and its surfaces and borders, hilum, its structures and its relationship with neighboring structures, blood supply, arterial, venous supply, and lymphatic drainage, nerve supply, motor and autonomic supply, pleural and its blood supply and nerve supply. Anatomy of lungs. Lungs are, as you know, lungs are paired structures. They are the organ of respiration. Situation in thoracic cavity on either side of the heart and mediastinal contents. Each lung lobes, there are three lobes, three on the right side and two on the left side. So total five lobes. Apex, base, two surfaces and three borders, fissures, two on the right side and one on the left. And root and hilum of the lungs. Surfaces has got two surfaces, costal and mediastinal surfaces. Borders, anterior, inferior and posterior borders. If you see, this is a picture of the lung. This is right lung, this is left lung. This is the anterior border, costal surface, then hilum. In right side and left side, there is an important thing which you have to remember. Hilum contains two bronchus on the right side, then pulmonary artery and then pulmonary vein. So it is bronchus, artery and vein. Bronchus, artery and vein. Whereas in the left side, it is vein, bronchus and artery. Sorry, vein. Sorry, artery, bronchus and vein. Artery comes first on the left side. Apex of the lung protrudes above the thoracic inlet, extension anteriorly inner margin of the first costal cartilage, posteriorly neck of the first rib, summit of apex 2.5 cm above the junction of the middle and medial one-third of clavicle, covering by the cervical pleura and suprapleural membrane. These are the relations of the apex of the lung. Apex of the lung anteriorly bounded by subclavian artery, posteriorly by the three structures which are related to the neck of the first rib from the medial to lateral. Stellate ganglion, superior intercostal artery, ventral ramus of first thoracic lung. These are the relations of apex of the lung. Relationships of the apex. Anterior, the subclavian vessels groups on the anterior surface of the apex of the lung. Posterior, the cervicothoracic or stellate ganglion, superior intercostal artery, and ventral rami of the T1 spinal nerves. Laterally lies the scalenus medius vessel. Medially, right side lies the right brachiocephalic vessels and trachea. On the left side, the left subclavian artery and the left subclavian vein. Costal surface is smooth, convex and vertical, deeper posteriorly contact with the costal pleura. Base, shape, concavity and semilunar shape rest on the superior surface of the diaphragm, separates the right lung from the right lobe of liver, left lung from the left lobe of liver, fundus of the stomach and spleen. Posterolaterally, the base has a sharp margins which forms the costodiaphragmic braces. Mediastinal surface, the posterior vertebral part, contact with the thoracic vertebra and intervertebral disc, posterior intercostal vessels and flanking nerves. Anterior mediastinal part on the left side forms cardiac notch. Mediastinal surface has a triangular hilum through which various structures enters and leaves the lungs. Pulmonary ligament formed by extension of the parietal pleura below the hilum. Right lung anterior to the hilum is the impression called cardiac compression, right auricle and anterior surface of the right ventricle. Above the hilum, superior vena cava and terminal portion of the right brachiocephalic vein. Posteriorly, there is a groove which arches over the hilum formed with the esophagus vein. Right side of the esophagus behind the hilum. Major structures related to the right lung mediastinal surface. These include the right atrium, inferior vena cava, superior vena cava, esophagus, right subclavian artery and vein arch over and are related to the superior lobe of the right lung as they pass over the lobe of the cervical pleura and into the axilla. This is the subclavian artery. This is the subclavian vein. This is the bronchus to the superior lobe. This is the bronchus. This is the esophagus. This is the azygous vein. Okay, this is the bronchus. This is artery, this is vein. So this is right side. So whenever bronchus comes first, bronchus to superior lobe, then artery, then vein, B. That is right side. Anterior to the hilum, cardiac impression formed by the left ventricle and left auricle, groove which arches over in front, above and behind the hilum, which is formed between the ascending aorta, arch of aorta, and descending thoracic aorta. Inferior to the hilum is the pulmonary ligament and summit of the apex. Narrow groove for the left subclavian artery and just in front the left brachiocephalic vein. Major structures of the left side. Left side, here you can see the pulmonary artery. This is the bronchus and this is the vein. Major structures related to the left lung mediastinal surface. These includes the heart, the left ventricle, the aortic arch. This is the aortic arch. Okay. This is the left subclavian artery. This is the left brachiocephalic vein. Pulmonary artery, bronchus. This is the esophagus. This is thoracic aorta. See, though, this is the thoracic aorta. This is curving above the hilum. This is the esophagus. This is the heart cardiac impression on the lung. These are the pulmonary veins. Okay. This includes the heart, left ventricle, aortic arch, descending thoracic aorta, esophagus, left subclavian artery and vein arch over and are related to the superior lobe of the left lung as they pass over the dome of the cervical flora and into the axilla. Borders of the lung. There are three borders: inferior, anterior, and posterior borders. Okay. Inferior border, it separates the base from the costal surface and medially from mediastinal surface. Posterior border separates base costal surface from mediastinal surface. Anterior border separates mediastinal from costal surface. Fissures and lobes. Right lung, there are three lobes: superior, middle, and inferior lobes. Left lung, there are two lobes: superior and inferior lobes. Fissures. Right lung has got major for oblique fissure which separates inferior lobe from middle and upper lobes. Minor short horizontal fissure separates superior and middle lobes. Okay. Here, accessory fissures and lobes. Medial part of the upper lobe is separated by fissure of variable length enclosed in mesentery derived from mediastinal flora. Terminal part of asagus veins. Lobe of asagus supplied by one or more branches bronchus. Inferior accessory fissure separates medial basal segment from the rest of the lower lobe. Superior accessory fissure separates apical segment of the lower lobe from basal segments. This is the mesoasagus. This is the asagus. This is the asagus vein. Okay, these are the anteromedial view of the right lung with asagus lobe. This mesoesophagus is MA. This is mesoesophagus. Then AL is asagus lobe. RSL, this is right superior lobe, right middle lobe, and right inferior lobe. Upper lobe, lower lobe separated by lingula. This is the lingula lobe. This is oblique fissure. Oblique fissure in the upper lobe and left lobe. Surface marking of fissures. Major fissure, right lung begins at the posterior superior part of hilum, reaches the posterior border 6 cm below the apex. On the posterior border starts at the level of T3, T2 spine, descends across the fifth intercostal space, and follows the sixth rib till its costocondral junction. Crosses the inferior border of the lung 7.5 cm behind the anterior vein. Minor fissure starts at the sternal end of the post of the costal cartilage to meet the oblique fissure in the mid-axillary line and passes backwards on the mediastinal surface till hilum. This is apex of the lung, anterior border is hilum, costal surface, base. Then this is the inferior border. This is the mediastinal surface. This is the posterior border, hilum, apex of the lung, left lung, right lung. Okay. Right lung, if you see right lung, this is the bronchus, this is the artery, this is the pulmonary veins, pulmonary artery, and bronchus. This is the pulmonary artery, bronchus, and vein. Then this is the surface marking of fissures and lobe. If you see this diagram, D2 spine, T2 thoracic, second spine, from there along the medial border of scapula, you will draw an oblique line. This line comes at and meets in the sixth costal cartilage. From the fourth costal cartilage in the medially near the sternoclavicular joint, you will draw a horizontal line meeting this line at the fifth costal cartilage, fifth intercostal space. Okay, this is the horizontal line, and this is the horizontal fissure, and this is the oblique fissure. Here you can see the right upper lobe, right middle lobe, right lower lobe. This is the horizontal fissure separating the upper lobe and middle lobe. This is the right lower lobe separated by the oblique fissure. Left upper lobe, left lower lobe separated by the oblique fissure. Okay, in the same you can see that this is the major fissure, right upper lobe, right middle lobe, right lower lobe. Okay, right upper lobe, right lower lobe, right lower upper lobe. Okay, next. Put surface marking of left major fissure. Left oblique fissure is more vertical than the right one. Begins at the posterior superior part of the hilum, crosses the posterior border 6 cm below the apex. At the posterior border lies a 2 cm lateral T3 T4 spines. Fifth intercostal space in the mid axillary line intersects the inferior border of the lung at 6th mitochondrial junction. Phylum root of the lung connects lung to the trachea, heart through various structures entering or leaving it. Lies at the level of T5 to T7 thoracic vertebra. Structures in the hilum: principal bronchus, pulmonary artery, two pulmonary veins, bronchial vessels, bronchopulmonary lymph nodes, pulmonary autonomic plexus, and loose connective tissue. Bronchopulmonary segments: each lung has functionally independent unit of lung tissue, that is bronchopulmonary segment. Each bronchopulmonary segment supplied by segmental bronchi and the pulmonary artery branch. Tributaries of pulmonary veins passes intersegmentally and around the margins of segment. Shape is cone-shaped apex, origin of segmental bronchi and base periphery on lung surface. Right lung is the left lung, apical segment, posterior segment, anterior segment. This is a horizontal oblique fissure. Sorry, this is the horizontal fissure, the oblique fissure. These are the segments of the lung. When you go inside the right side, first you will see the apical segment, then you will see the anterior and posterior segments. Okay, three segments of the right upper lobe. Then if you go middle lobe, then you will see the medial basal segment and lateral segment. Okay, medial basal middle lobe consists of medial segment and the lateral segment. Lateral segment, medial basal and the lateral segment. Inferior lobe, you will see the superior segment, then posterior basal segment, and anterior basal segment. Okay, we see the left lobe. Left lung. Left lung has apical posterior segment. Okay, then apical posterior segment, then anterior segment, superior lingular segment, inferior lingular segment, superior basal segment, lateral basal segment, anterior medial segment. This is the oblique fissure. This is the inferior lobe. This is the superior basal segment, lateral basal segment, anterior medial segment. Okay. There are 10 bronchopulmonary segments in each lung. Right lung superior lobe is apical, posterior, and anterior segments. Middle lobe, lateral and medial segments. Superior, apical, medial basal, anterior basal, lateral basal, and posterior basal segments. So there are three bronchopulmonary segments in the superior lobe, two bronchopulmonary segments in the middle lobe, and five bronchopulmonary segments in the inferior lobe. Superior, medial basal, anterior basal, lateral basal, and posterior basal segments. Left lung has apical segment, posterior segment, anterior segment, superior lingular, inferior lingular. So total 5 segments in the superior lobe of the left lung. Inferior lobe, there is a superior apical, medial basal, and anterior basal, lateral basal, and posterior basal segments. Right lung, right hilum structure in the hilum from above downwards. Superior lobar bronchus is the epiarterial bronchus. Epiarterial bronchus is the right hilum. Epiarterial bronchus, then pulmonary artery, then principal bronchus is the hyparterial bronchus and pulmonary veins. Relation to the hilum: anteriorly superior vena cava, right atrium, phrenic nerve, pericardial phrenic vessels, and anterior pulmonary plexus of nerves. above arch of asparagus vein, behind the island is the esophagus. Posterior relation vagus nerve and posterior pulmonary plexus of nerves. Major structures related to the right lung, mediastinal surface. These include the right atrium, inferior vena cava, superior vena cava, esophagus, right subclavian artery contain arch over and related to the superior lobe of the right lung as they pass over the dome of the cervical flora and into the axilla. Um, Subclavian artery, the subclavian vein, right brachiocephalic vein, left brachiocephalic vein, superior vena cava, pulmonary artery, pulmonary veins. This is the bronchus to the superior lobe, bronchus, esophagus, esophagus vein, inferior vena cava. This is the diaphragm. Okay. These are the major structures related to the left lung, mediastinal surface. These include heart, the aortic arch. This is the left subclavian artery, left subclavian vein, aortic arch, pulmonary artery, bronchus, pulmonary veins, and this is the esophagus, this is the thoracic aorta. Okay, the major structures related to the left lung mediastinal surface are they include the heart, aortic arch, descending thoracic aorta, esophagus, left subclavian artery, and vein arch over and are related to the superior lobe of the left lung as they pass over the dome of the cervical flora and into the axilla. Left hilum. Structures in the left hilum from above downwards, pulmonary artery, principal bronchus, and pulmonary veins. Relationship of the left hilum anteriorly lies the phrenic nerve, pericardiogenic vessels, and anterior pulmonary plexus. Above and behind the arch of aorta. Posterior relations are vagus nerve and the posterior pulmonary plexus. Vascular supply consists of two functional circulatory pathways, the pulmonary circulation and bronchial circulation. The pulmonary circulation is formed by the pulmonary artery and four pulmonary veins. Pulmonary circulation is formed by pulmonary arteries and four pulmonary veins. They carry deoxygenated blood from the right side half to the alveolar walls where oxygenation takes place, drain via the pulmonary veins into the left heart chamber. Bronchial circulation formed by the bronchial arteries from the systemic circulation, which provide oxygenated blood to the lung tissue. Pulmonary artery. Right pulmonary artery divides into two branches behind the superior vena cava. The superior branch supplies the superior lobe. The inferior branch, the anterior branch, the middle lobe, posterior branch, superior segment of the inferior lobe continues for short distance and supplies whole of the inferior lobe. Then you can see that there is a this is the trachea. Okay, this is the trachea. Divides the right and left main bronchus. This is the right main bronchus. Okay, this is the superior pulmonary trunk, right pulmonary trunk, and this is the left pulmonary trunk. That gives rise to superior division of pulmonary artery. There is one division called superior division of pulmonary artery. Then up we go posterior branch, segmental branches, basilar branches. So pulmonary artery supplies the segments, basilar arteries, and superior division of the pulmonary. Okay. Then there is an anterior branch. This is the left main bronchus. This is the left pulmonary artery. Okay. Then this is the upper lobe bronchus. This is the lingular bronchus. Okay. These are the lingular branches, superior segmental artery, superior segmental bronchus, basilar branches. Again, if you see, this is the pulmonary tongue, the right bronchial artery, right pulmonary artery. This is a right pulmonary artery. Okay. Then you see the right pulmonary veins. This is the pulmonary trunk. This is the left pulmonary artery, left pulmonary veins. Aortic arch, superior left bronchial artery. This is the right bronchial artery branch from the right bronchial artery. This is an important MCQ which they will ask. A right bronchial artery, left bronchial artery. The right bronchial artery arises from the branch from the right third posterior intercostal artery. Posterior intercostal artery, right third posterior intercostal artery gives rise to right bronchial artery. The left bronchial artery, it arises directly from the aorta. Left pulmonary artery. Left pulmonary artery. It descends anterior to the descending thoracic aorta to enter the hilum. Branches. The first branch, anterior segment of left superior lobe, branches to the superior lobe. After entering fissures, branch to the superior segment of inferior lobe, multiple branches to the rest of the lower lobe. Pulmonary veins, superior right pulmonary vein, formation union of apical, anterior, posterior lobar veins with the middle lobar vein. Position in hilum, anterior, inferior to the pulmonary artery. Inferior right pulmonary vein, formation union of apical and common basal veins from lower lobes. Position in hilum. Termination, both the veins perforate the fibrinous pericardium and terminate into the posterior superior aspect of left atrium. This is the trachea. Okay. The tracheal bifurcation, right and left main bronchus. These are the segments of their respective bronchus. Left pulmonary veins. Superior left pulmonary vein formation union of apico-posterior with anterior and angular veins. It is anterior inferior to the pulmonary artery in the hilum. Inferior left pulmonary vein formation union of superior and common basal vein. Superior and inferior basal vein. It occupies the inferior most position in the hilum. Bronchial circulation supply the oxygenated blood of pulmonary tissue. Right bronchial artery, left bronchial artery. Right bronchial artery is the branch of third posterior intercostal artery. Left bronchial artery, two in number, origin from the descending thoracic artery. This is very important. Multiple choice question which they will ask surely where entrance you go. Right bronchial artery. Right bronchial artery is a branch of posterior intercostal artery. Third posterior right bronchial artery is a branch of posterior third intercostal arteries. Left bronchial artery is a branch of left bronchial artery is two in number. One in number. Left bronchial artery is two in number. They are branch of descending thoracic aorta. Bronchial glands bronchi till the respiratory bronchus walls of pulmonary vessels. This is the third right posterior intercostal arteries, which gives rise to the right bronchial artery. This is right main bronchus, left main bronchus, left bronchial, left bronchial artery from the aorta, thoracic aorta. Okay, so there are one right bronchial artery and two left bronchial arteries. Bronchial veins, superficial bronchial veins, extrapulmonary bronchial, visceral pleura, hilar lymph nodes, terminates into the azygous vein in the right side and left to superior intercostal axillary images vein on the left side. Deep bronchial veins or intrapulmonary bronchial plexus communicate with the pulmonary veins, terminates in left atrium and pulmonary veins. Bronchial arteries and veins. Bronchial arteries, they are nutritive vascular system of the pulmonary tissues or parenchyma. Okay, the branches of aorta are its branches because the right side bronchial artery arises from the third posterior intercostal arteries. Okay, the left side bronchial artery it arises from the descending aorta. Okay, they run along with the bronchial. Bronchial veins they drain the parenchyma, drain primarily into the azygous venous system. This is the bronchial veins where they drain primarily into the azygous vein. These are the bronchial arteries. Then you go to lymphatic drainage. See, the lymphatic drainage consists of the superficial subpleural plexus of lymphatics. They drain peripheral lung tissue lying beneath the visceral pleura. The lymphatics pass around the borders of the lung and margins of fissures to reach the hilum. Finally, drain in bronchopulmonary lymph nodes in the hilum. Okay. I don't think it's very clear. Okay, the deep lymphatic plexus. It lies in around the bronchial tree and pulmonary vessels and drain into the pulmonary lymph nodes in the lung parenchyma. Here, drainage into the bronchopulmonary lymph nodes. bronchopulmonary lymph nodes, if they drain to tracheobronchial lymph nodes, then bronchomediastinal lymph nodes end in the thoracic tract on the left side and right in lymphatic tract on the right side. These are the group of lymph nodes. Okay. You see, this is the deep lymphatics. In the pulmonary lymphatics, they drain to bronchopulmonary or hilar nodes, then they drain into tracheobronchial nodes, paratracheal nodes, bronchomediastinal nodes, and left side they drain into the thoracic tract. Left side they drain into the thoracic tract. Right side they drain into the right lymphatic tract. Then they drain into the venous nerve supply. Nerve supply to the lung parenchyma is autonomic, both sympathetic and parasympathetic. Pulmonary plexus anterior to the posterior pulmonary plexus. Anterior pulmonary plexus is under the rami from the superficial. Nerve supply to the lung parenchyma. So we are nerve supply. So nerve supply to the lung parenchyma is autonomic, both sympathetic and parasympathetic. Pulmonary plexus, the anterior and posterior pulmonary plexus. The anterior pulmonary plexus, sympathetic supply rami from superficial cardiac plexus, parasympathetic rami from the vagus nerve. Posterior pulmonary plexus, anatomy of pleura. Next is anatomy of pleura. These are the serous membrane lined with mesothelium, flattened epithelial cells. Has got two layers, outer parietal pleura and inner distal pleura. Both layers are continuous at each other at hilum of the lung. Pleural cavity, potential space between the parietal and distal pleura. It covers the distal pleura. It covers the surface and fissures of the lung except at the hilum and pulmonary ligament. Okay. These are the cervical pleura. This is the pleural cavity. This is the visceral pleura outside the parietal pleura. This is the cervical pleura, endothoracic fascia, the cardiac march, lingula, the diaphragmatic part. This is the mediastinal part. This is the diaphragmatic part. Diaphragmatic part, mediastinal part. This is the costal part. This is costal part. Parietal pleura. It's costal, mediastinal, diaphragmatic, and cervical pleura. Costal pleura covers the costal surface of the lungs and lines the thoracic wall separated from it by endothoracic fascia. Mediastinal pleura lines the mediastinal surface reflected over the hilum to become the continuous with the visceral pleura. Diaphragmatic pleura lines the superior surface of the diaphragm, covers the base of the lung, medially mediastinal pleura, laterally costal pleura. Cervical pleura covers the apex of the lung, lined by the suprapleural membrane, anteriorly related to the subclavian artery and the scalenus anterior, posterior neck of the first rib, laterally to scalenus medius muscle. Pulmonary ligament, the parietal ligament and the hilum extends beyond the hilum, inferior as a fold. There is the pulmonary ligament, contains thin layer of loose areolar tissue and lymphatics. Recesses of the pleura acts as a reserve space for lung to expand during deep inspiration. Costal mediastinal recess between the costal and mediastinal pleura in relation to the cardiac march of the left lung. Costal diaphragmatic recesses inferiorly between the costal and diaphragmatic pleura extends from the 8th to 10th rib along the mid-axillary line. Surface marking of pleura, cervical pleura to the line forming dome over the medial omnitor of the clavicle 2.5 cm above the clavicle. Costomediastinal line of the pleural deflection on the right side extends from the sternoclavicular joint downwards and medially to the midpoint of sternolateral. Continuous till the midpoint of xiphisternal joint, crosses the xiphicostal angle on the left, follows the same course till the fourth vertex, then arches outwards and descends till the sixth vertex. Costodiaphragmatic line of pleural deflection passes directly from the lower limit of anterior margin of the 8th rib in the rectangle, 10th rib in the mid-axillary line, and the 12th rib at the lateral border of sacrospinalis muscle. Further, it passes horizontally to 2 cm laterally to the upper corner of the T12 spine. Posteriorly, 2 cm lateral to C7 cervical spine and 2 cm lateral to the T12 thoracic spine. The costal pleura becomes the mediastinal pleura along the posterior margin. Vascular supply to the pleura, arterial supply, parietal pleura intercostal artery, costellar coronary artery, infrathoracic artery, visceral pleura supply to the bronchial artery. Venous drainage, ascending vein, and internal thoracic veins for parietal pleura and bronchial veins for distal pleura. Lymphatic drainage of pleura, parietal pleura drains into the intercostal, internal mammary, posterior and diaphragmatic lymph nodes. Distal pleura drains into the bronchopulmonary lymph nodes. Lymphatic drainage, these are the lymphatic drainage, parietal lymphatic drain into the intercostal, internal mammary, posterior and diaphragmatic nodes. Distal pleura, it is drained by the bronchopulmonary lymph nodes. The distal pleura is drained by the bronchopulmonary lymph nodes. This is a very important MCQ. The parietal pleura, the lymphatics drain the intercostal, internal mammary, posterior, drain into the posterior mediastinal and diaphragmatic lymph nodes. The visceral pleura, innermost line, it drains into the bronchopulmonary lymph nodes, PP lymph nodes, bronchopulmonary lymph nodes. The parietal pleura is PP pain sensitive. Double P is pain sensitive. The visceral pleura is supplied by the it drains into the bronchopulmonary lymph nodes. Parietal pleura is a pain sensitive organism. Whenever you insert a needle, when it pierces the parietal pleura, you have severe pain. Lung parenchyma and visceral pleura doesn't experience pain. They are pain insensitive. This is pain sensitive. Okay. Motor supply, the costal and peripheral parts of the diaphragmatic pleura supplied by intercostal nerves. Mediastinal pleura and central part of the diaphragmatic pleura supplied by phrenic nerve. Okay. Phrenic nerve, central part of the visceral pleura, anterior posterior pulmonary plexus. The important point you have to remember is the parietal pleura is pain sensitive, parietal pleura is pain sensitive, and the visceral pleura is pain insensitive. Parietal pleura is pain sensitive, visceral pleura is pain insensitive. Parietal pleura is visceral pleura is drained by the bronchopulmonary lymph